This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Sounds good. Hi, everyone. My name is Michael Bova. I'm one of the PGY4s here at University of Virginia, one of the chief residents. Thank you so much for coming to this presentation. As always, I welcome questions. You can feel free to type them in while I'm presenting. It might be easier, however, to do them at the end just for the sake of time. So we can get started. So again, this is the University of Virginia in Charlottesville, Virginia. So we are a four-year program here with categorical positions. This is University of Virginia. This is on the main campus here, kind of what we're known for, Thomas Jefferson and everything that's associated with him. So this is the general outline, so who we are, curriculum, extracurricular things, where our alumni have gone, and a little bit more about Charlottesville coming up later. So we have 12 residents, PGY 2 through 4. This is a picture of us over to the right. This is about a year and a half, 2 years ago, kind of the best photo that we have so far. So we have 4 residents per year for each of those classes. We also, as I mentioned earlier, offer 2 categorical intern positions. And then our department is made up of, I think there's actually one more faculty that was added on, so it should be 15 now, but we have 3 that are board certified in sports medicine, 2 in spinal cord, 2 in brain injury, 2 in electrodiagnostics, 1 board certified in pain medicine, a couple who are interventional spine folks, and also we have specialists who work in ultrasound, regenerative medicine, and cancer rehabilitation as well. So we like each other, or we tend to like each other. We do a lot of extracurriculars outside of work. Everything is very accessible in Charlottesville, and so we do get to spend a lot of time together. This is a couple of our classmates from prior years. And then, of course, the beautiful Shenandoah Valley down at the bottom of the screen. So for our PGY1 categorical positions, it is a fairly even distribution between inpatient and outpatient rotations. So in general, you spend 12 weeks with the general medicine folks in their inpatient wards. 2 rotations are with general medicine, and 1 is a GI Gen Med mashup, which is intensive, but prepares you very well for the medicine folks that you'll be seeing in the inpatient side of things come PGY2. We do a month of our general medicine outpatient clinic. You spend 2 rotations with the neurology team. That's probably kind of our best relationship that we have during our PGY1 experience. Just for reference, I did the categorical program here at UVA. I thought it prepared me very well. It was a wonderful experience. As you can see, a very well-rounded experience for sure. So there's 2 rotations that you spend with orthopedic surgeons. Personally, the orthopedic spine rotation that we did was probably my favorite rotation. You learn very quickly how to read imaging when you're shuffling through 40 to 50 patients a day. It was a lot of fun. You do a month of emergency department. We do have 1 rotation where you spend time with us in the PM&R department. And so you'll see a little bit of everything when you're there, outpatient, inpatient, you spend time at a spine clinic. And then we make sure that you have a nice holiday during that rotation as well. And then the urology, inpatient and outpatient experience. We tend to favor the outpatient experience more, tends to be a little bit more helpful when it comes to the PGY2 experience that comes up in the years to come. So PGY2 is separated out into 4 different categories. We have the neuro rehab, spinal cord injury, the orthopedic, and the general rehab blocks. Each of these is a total of 3 months, but we split them up into 2 6-week divisions. So you rotate through every 6 weeks onto a different service. A couple of things that we've updated over the last couple of years. We have given our PGY2s 2-week blocks off where they rotate with our PM&R consult team at the main hospital. That kind of breaks up the PGY2 experience, gives them a little bit more of a vantage point of everything that they're doing while they are at the rehab hospital, kind of seeing from both ends a little early on. And then we have also instituted a 1-week elective. We've done this for a couple reasons. One, to again give a little bit more of a glimpse at what PM&R looks like when you're not on the inpatient side of things, but it also gives a little bit of flexibility for those who know that they might want to go into pain or a fellowship such as this, where, as my predecessor alluded to, time is of a little bit of an essence when you want to do a pain fellowship. You want to get on that early, so you want to kind of know if you have any question, whether it's something you want to do. So this 1-week elective gives you an opportunity to kind of get out of the inpatient side of things and see something else, try to prepare for the future a little bit. This is our rehab hospital. So it's a joint venture between the University of Virginia and Encompass Health. So inside, obviously, we have what you would expect in a rehab hospital. So we do have assistive devices. We have, you can't, if you put it together a little bit between the photos, one giant therapy room that kind of connects between a couple of these photos. It's a 2-floor, it has about 50 beds. It is standalone, which, depends on who you are, whether standalone or part of the main hospital is more advantageous of the two. But it's a real world experience. You get to see how inpatient hospitals are run, especially when they're in the joint venture category. It's a couple of our PGY3s training our upcoming PGY2s. Don't look at the gangly guy over to the right. That may or may not be me. But we do have a really nice transition period because the learning between PGY1 and PGY2 can be a little bit of an uphill climb. So we make sure that you're trained really well before we set you to sail and have you do things on your own. So PGY3, so this is again broken up into 4 kind of 3-month blocks with a little bit of variation between within some of those blocks. So you spend 3 months with the PM&R Musculoskeletal Clinic, and within that clinic, you're spending time with sports medicine, general MSK, rheumatology, P&O. Almost all of this is taking place at our new Ivy Mountain Orthopedic Center, which was just built and christened this past January. Beautiful new building, all the bells and whistles, a wonderful place to work. You do spend 3 months on electrodiagnostic medicine. In between the PM&R musculoskeletal and the electrodiagnostic medicine rotations, I think these are the core essence of the highlights of our program. The training is absolutely fantastic. I would say that 200 EMGs over the course of 3 months might be a low estimate. There have been a couple of residents who've come through who graduated with us that have gotten close to 1,000. But there's never an issue with getting our numbers when it comes to EMGs. The training is quite remarkable here. We have 2 months of inpatient consults that we spent. The other month that would make up the 3rd month, you would have already done during your PGY2 rotation. You spend 1 month with pain management. This is with our UVA pain clinic under the Department of Anesthesia. So you work directly with the fellows and with the pain faculty while you're there. Again, if you want to go into pain, make it so that you can get this done early so that you can have a good sense of whether or not you want to go into pain before the application cycle starts up. You spend 1 month with outpatient physiatry, which is a combination of neuromuscular clinic We do some wound care and ultrasound, and then you spend 1 month on an elective rotation. So these a couple of photos from our PGY3 experience. This is Dr. Gibson. You spend most of your P&O time with him. And this is Dr. Smith, who works with some of our medical students as well as us. He's our spinal cord injury guru, and he teaches us a lot about spasticity. And during PGY4, so highlights here, you do have 4 months of clinical electives. Part of that you spend as the ward senior at the inpatient rehab hospital during the months of July and August, just helping with transition. But you do have ample amount of time for clinical electives. You spend 3 months on electrodiagnostic medicine as well, this time as the senior on the service, helping train the junior. And then you also spend 2 months with the pediatric rehabilitation, which is a mashup of multidisciplinary clinics and specialty clinics that you work at, mostly over at the main hospital. You spend 1 month on occupational medicine, learning independent medical evaluations, manual medicine, learning how to do all of these evaluations that are necessary in the outpatient setting. You do 1 month of interventional spine with some of our interventional spine physiatrists. That's both clinic and doing procedures in the floor suites. And you also spend another month with outpatient orthopedics, and this can be with any of the outpatient orthopedics departments that you want, from spine to sports, foot and ankle. We do have an excellent orthopedic service here. So extracurriculars, big highlights. There are plenty of coverage opportunities when you're working here at UVA. We spend a lot of time with local high school teams, football, we do races, a lot of marathons. You'll find that, University of Virginia and the Charlottesville area are very running heavy. Everybody runs, and when I say everybody runs, I mean everybody except for me. But there's a lot of opportunities for sports medicine coverage here, as much as you can get as much as you could want. We do have ultrasound courses that are led both by one of our faculty who is RMSK certified, and then the upperclassmen, myself included, will teach a little bit of the ultrasound courses, both formally during didactics and then also whenever we can steal our residents away and learn a little bit more. We also have interventional spine courses. So our ACGME pain fellowship trained attending, Dr. Grice, who you can visualize scowling at me as I'm sure I'm doing something wrong here in our cadaver lab. He teaches 2 courses that are 6 weeks long, kind of fit in around clinic times. One's cervical and one's lumbar, and it really, if it was out in the private world, it'd be a multi-$1,000 course, but he does it for us because he just wants us to learn and be the best that we can for those who want to go into into pain medicine. So our didactics and our research. So for didactics, we have protected time during around lunchtime every day. The didactics are arranged by monthly topic. So for example, right now we are doing pediatric. We have a joint of the month. This one is shoulder. We will have grand rounds. We'll have journal club. We'll have PM&R book club, where we do a lot of board review. We have a dedicated ultrasound lecture. That's a hands-on lecture with one of our attendings. And we also do SAE review more formally with our attendings. The research is resident driven. Anything that you can want, we have the resources through our department and through other departments to get you started on whatever you want. It really is as much or as little as you would like to be a part of. All residents do a QI project here. It's a big focus of ours. And then you can do 1 month out of the 4 months that we have available to you to do research. And then we do have up to $2,000 for travel, training, conferences, etc. So this is Dr. Jenkins. He's our program director. Next to him, previous graduates, Dr. Weckler, who's on faculty with us, Dr. Frost, who's doing interventional spine, Dr. Ide, who's doing pediatrics out in Maryland, Dr. Sapp. We'll go through some of these on our alumni slide, but generally, we have a lot of folks who really love research and love presenting. So these are some of our alumni over the past 5 years. Most recently, we had someone going to fellowship here at UVA for neuromuscular medicine, one going to interventional spine out in New Jersey. One stayed on. Dr. Warwick is new academic faculty with us here at University of Virginia. Really, everybody, people go into a lot of different things. We have people go into sports and pain, spinal cord injury, brain injury. People go into private practice and who stay on as academic physiatrists. And as you can see from the locations, people go everywhere. We have a wonderful alumni system who take great pride in the training that they got here and are willing to help in any way that they can. It's probably one of the highlights that I will remember when I graduate, and I hope I carry on with future classes. So Charlottesville.
5 minutes left.
Thank you.
Oh, sorry, I was just giving a 5-minute warning.
Thank you. So Charlottesville is well known for being one of the best places to live in the nation. You can see all of our accolades, and these are not, there's no lie on here. It is a smaller city with a lot of opportunities for food and drink and outdoor activities and education. My favorite is Good Housekeeping said it's the happiest place in a city in America to live. I just think that's remarkable. 2017 National Geographic put out the 25 happiest places to live, and Charlottesville was number 3. Found that quite remarkable, and I'm not surprised. It's a great place to live. So overall, our strengths, we have a very robust elective time. Again, we have a total of 4 months that we spend in elective, unless I'm counting that wrong. But we also have a very strong sports medicine, MSK, and frankly, electrodiagnostic training here. We have a lot of procedural opportunities for those who are more procedural oriented. And probably another highlight is our mentorship. There's always an opportunity for you to speak with your mentor who you establish in PGY1, and if you're a categorical, and carry through during your 4 years here. So with that, I think I'll end. We do have an Instagram, UVA PM&R. Please follow us, and I'll open it up for questions from anybody.
Hi, I'm just going to ask from the mic. Just want to ask, what sort of characteristics or attributes do you find in very successful visiting students?
Yeah, so I think that Brian from NYU said it best. Enthusiasm is something that can't go. It can't go without saying. You need to be enthusiastic when you're doing rotations at any program, at UVA, PM&R included. We tend to really see our visiting students in a new light. You came all the way out to visit with us to see how our residency program runs. We want to see you put your best foot forward, taking initiative, learning as much as you can, and just showing us what your skill sets are. And I think that with enthusiasm and a willingness to, learn as much as you can while you're here, it'll go a long way for your visiting. At least one question in the chat. Anju, is there opportunity for DOs to further their OMT skills, either through electives or attendings that may use OMT in their practice? Yep, we do have DOs who are on faculty with us. So Dr. Jenkins is on chat with us.
Yeah, I think we have 6 DO faculty, but 3 of them actively employ OMT as part of their clinical practice. So we've had workshops and courses for interested students whenever we get a critical mass of folks interested in it. So it's very doable. There is a track record for that. Hi, I'm Jeff Jenkins, Residency Program Director, and Michael Bova's faculty mentor as of a week ago. So something like that. Late to the party and underdressed, but hey, I'm here.
So how many residents have been able to match in sports medicine fellowships? This is from Amara. Two within the last 4 years. Is that correct, Dr. Jenkins? 5 years?
Just sports medicine, like primary care sports medicine, because spine and sports would double that. But I can say we've never had never had one of our residents fail to match in sports medicine. You know, Bob Wilder, our chair, is a sports medicine guy, one of the few chairs of an academic program with the residency training program whose subspecialty is sports medicine. So needless to say, he's well connected if you want to get a sports fellowship. We have one here, and we've had, I think, 3 of our graduates do the one here at UVA. But we've had folks go all over the place recently. You know, Dr. Reiser on that alumni slide went to Stanford. The year before that, Ryan Coate went to NYU. We had John Latin also on that slide, went out to Fort Worth. And I don't know, Glenn Sapp recently, Georgetown, of course, who's now on Georgetown's faculty. Shout out Glenn Sapp, tremendous junior faculty member. But anyway, yes, like I said, we've never had one of our grads who pursued a sports medicine fellowship fail to match.
Awesome. Thank you guys so much. I think there might be like a couple additional messages, questions in the chat. If you guys want to just like answer those via the chat, that way we can keep things rolling. But thank you guys.